Hi everyone, I'm happy to bring you this new in-service on a process we've been working on for quite some time called CODE STEMI. It'll be helpful if you have the protocol to actually review. If the protocol is not out yet in the protocol books when you're going through this training, you can get it and print it from within the CenterLearn system. This new process will be in conjunction with our partners, Norton Healthcare. Norton Healthcare is a progressive health system that has recognized, along with the American Heart Association, the positive role that EMS can play in reducing the time to definitive treatment for STEMI patients. For now, the CODE STEMI process applies to Norton Hospital downtown only. They have 5 cath lab tables and are the best suited for this process. If you happen to be transporting a routine patient to Norton Brownsboro or Norton Audubon, and you recognize a new presentation of STEMI, you can use the CODE STEMI protocol. However, their process will be slightly different than I'll describe in this training. The benefit of this program is early activation. A key factor in this process is the patient's right to choose what hospital they wish to be treated at. So it's important that you make this determination early in the process. As soon as you recognize a STEMI and the patient meets all criteria and wants to go to Norton Hospital, call the Access Center at 1-888-486-6786. You'll need to state the words CODE STEMI and be prepared to give the patient's name and any other demographic information that you may have. The Access Center will not usually ask clinical information. The people who answer this phone are not clinical providers. This is the same number that hospitals and physicians call to transfer a patient to Norton. During normal hours, the cath lab team will usually already be in the cath lab. Outside of normal business hours, their team has 30 minutes to be in the cath lab from their notification. If we call early enough, the team will be ready for the patient when we arrive. As with all patients, begin with the Universal Patient Care Protocol: a thorough assessment, vital signs, supplemental oxygen, cardiac monitor, and 12-lead ECG as necessary. If cardiac chest pain is suspected, proceed to the chest pain, cardiac, and STEMI protocol. Treat the patient as necessary with aspirin, nitroglycerin, morphine, and Zofran. The Norton Cath Lab has specific criteria for activating them using CODE STEMI. This doesn't mean you can't take a patient to Norton if they want to go there. However, without all the criteria being met, we will not call a CODE STEMI. It's important that we perform a thorough assessment, including cardiac risk factors and looking for anything that could cause complications during the catheterization. The CODE STEMI criteria includes active chest pain or equivalent symptoms. Equivalent symptoms may be dyspnea, nausea, weakness, syncope, or other similar symptoms. A high index of suspicion. Consider the risk factors of coronary artery disease, such as hypertension, hypercholesterolemia, smoking, and diabetes. You must have a good quality 12-lead ECG showing a STEMI. This criteria is the same as the AHA recommends. ST elevation of greater than 2 millimeters in 2 or more contiguous leads, and normal duration of the QRS complex. Also, the patient must be less than 85 years old. There can be no major bleeding and no major surgery in the past 6 weeks. No significant trauma. We have defined this as steps 2, 3, or 4 on the CDC triage decision scheme. This is the same as our trauma triage destination determination protocol. A patient or legal representative must be able to provide informed consent. Ideally, if the patient is unable to provide informed consent at the hospital, the legal representative should be with you or be at Norton when you arrive with the patient. Ask the patient if they have a cardiologist and try to get their name. Be prepared to hand a 12-lead ECG to the physician when you arrive in the cath lab. And when you arrive, if the cath lab team is not there, the patient may be held in the ER. As with any patient, documentation is vital. It's even more important with this situation. Somewhere in the PCR, all activation criteria must be documented. Import the Zoll X Series monitor data into the PCR. This is a medical director requirement for QA purposes. If you have IT issues with the data import, notify the EMS education coordinator with the medic number of the truck, and the data will be retrieved manually. As always, if you want to consult with medical control about a specific patient or an odd issue, that option is always available to you. However, medical control approval is not required to call a CODE STEMI. If you have called a CODE STEMI and during transport your patient goes into cardiac arrest, divert to the closest hospital. If you've already crossed the Sherman-Minton Bridge, continue to Norton downtown and notify the ER immediately at 502-629-3434. And finally, if you have any questions about this process, suggestions about the process, or encounter problems at Norton, please let the EMS education coordinator know about it. Also, I'm very interested to hear about your experience in this new process.